Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Julien Pham. He is a nephrologist and a healthcare entrepreneur. His Kevin MD article is titled The Evolving Role of Physicians in Healthcare. Julien, welcome to the show.
Hi, Kevin. How are you?
Very well. Thank you so much for joining me, and we'll talk about your article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, so I'm a son of immigrants, a second-generation physician. Came to the U.S. As a first-generation immigrant by myself when I was 14. Went to undergrad medical school at the University of Washington in Seattle. Did my residency in medicine pediatrics at University of Illinois at Chicago, and went into adult nephrology at Mass General Brigham in Boston. I went on after that to build two companies, one that I founded. The first one was Rubicon MD, which was a digital health company, which recently was acquired. And the second one was a gene therapy biotech that we took public. And armed with those two experiences, I decided for this next leg of my journey to be an investor. And so I founded this firm called Third Culture Capital here in Boston. We invest at the intersection of culture and care delivery. We do seed stage investments and have made 8 investments so far.
So tell me about your background as an entrepreneur. Have you always had this interest during your medical training?
You know, it's only looking back that I realized I did. Like many others, felt medicine was my vocation. I wanted to be the best academic clinician I could be, teach, do good in the world, treat patients, do some research, and maybe make a name for myself, but really wanted to kind of do the noble thing. It was really kind of serendipitous when I discovered entrepreneurship. And when I did, I just realized I had always been wired to be an entrepreneur. I just love building things, creating things. And looking back, even at my clinical journey, there have been several instances when things didn't exist as part of the training program. And I felt compelled that I had to build them, not for myself, but for the ones after me. And so I think that's really the spirit of entrepreneurship, is to feel that there's an unmet need or something that or problem, and that you have the passion and energy to build something.
Now, what kind of resources did you turn to? Because healthcare entrepreneurship isn't commonly taught during medical school and residency. So, when you decided that you wanted to build something that would fill that unmet need, where did you turn to for advice and guidance?
I agree with you. It's, in the traditional path of academia, you're really given 3 options, right? You can be a clinician educator, you can be, a researcher, and maybe do some administrative work. So really the path of a physician entrepreneur is one that you, at least back in the days, had to carve for yourself. I don't know if you remember, it sounds like you and I are maybe of the same generation, but doing an MBA was very much frowned upon, right? Maybe doing an MPH, which I did, was a little bit more kosher. But I self-taught myself, right? I picked up books, learned about entrepreneurship, various kind of models, and it was during the early days of hackathons that I really had the opportunity to learn more about entrepreneurial thinking, and I've learned a lot by doing, frankly.
And how did you have time to do this, like especially during medical training? And you mentioned you're in a med peds residency and then nephrology. And how did you have time to have this pretty much a second career on the side?
This is what I tell people, right? Innovation and creativity for a physician actually starts when you start to innovate your career or your schedule. I think that the minute that you make a decision to build something and be an entrepreneur, it's done, right? It's your destiny. It's hardwired in you. You are going on the path of entrepreneurship. And what you need to do next from a kind of practical, pragmatic standpoint is, how do you innovate your career and your job in order to find that time? So for me, the way I innovated in order to find time to build and to explore entrepreneurship was to go part-time in academia at Mass General Brigham, and to kind of supplement my income by moonlighting in a private practice. So I did that in the early days so that I could kind of leverage, that clinical experience and be able to supplement my salary in order to explore entrepreneurship. So it's hard depending on your specialty, right? If you are a cardiothoracic surgeon and don't do surgery, it's not like you can take some time off to build stuff. But if you're an ER doc, dermatologist, hospitalist where you're 7 on, 7 off, it's a little bit easier to kind of tiptoe into building something and explore that path.
All right. Speaking of the evolving role of the physician, that's the title of the article that you wrote on Kevin MD. Now, how did this article come about?
It's something I've been very passionate about because so many physicians at various stages of their career kind of reach out to me and say, "Hey, Julien, I'd love to kind of emulate your career and build companies or become an investor or something like that. Like, what is the first step? Like, what needs to be done?" And there's no kind of written path for that. I think you have to explore your own journey and kind of your own kind of risk taking mindset. But I would say that the advice that I give people is, number one, try to finish clinical practice because it's an incredible privilege. There's no other life experience that allows you to see what we see as clinicians, right? Do at least your residency. That's what I tell them. And then after that, it's wide open. You can invest, you can influence, you can build, you can educate, you can do so many things. And so, this article came out because I want to help my peers figure out a step in their own journey.
Now, for those doctors who want to go on that non-clinical entrepreneurial path, they want to become investors, one of the things that you mentioned is finding a mentor, finding someone who's already stepped on that path. Now, how does one go about finding people like that?
Yeah, I think you have to be social, right? You have to go and be very intentional about talking to people. The one thing I learned very quickly when I started Rubicon MD was how powerful the network of a physician was. We just don't realize that. And I was always looking at MBA students and how um, social they were. They would kind of create their own business card even though they didn't have a job, right? It just said MBA student, and they would just walk around and just introduce themselves and give their cards, and they have a very powerful network. True. But then when we built Rubicon MD and we needed to build a network of specialists, I tapped into my network and I realized, oh my God, like between medical school, residency, fellowship, and all the people we cross paths with, we have an incredible network that we can leverage. And so I think it's important for clinicians to kind of go out there and continue to build these relationships and find people that can be supportive of your goals and your career, especially people who've been there before, and find mentorship that way.
Now, a lot of doctors, they have a pretty set path, right? In order to finish residency, you do pre-med, medical school, intern residency, and then now they're a physician who could practice. And sometimes making that transition into a non-clinical path can be a little bit jarring, takes a little bit of time to transition. So in your case, how long did it take for you to feel comfortable taking that non-clinical path? Was it a big change for you?
It was a big change, right? And I think you have to commit to it. A lot of it has to do with your willingness to take risks. And for me, I was kind of willing to do that, and I was in a position where I could. And part of it was because I innovated my career, right? I was able to do this kind of part-time gig that kind of supplemented my salary. So I think that's the first step. You have to feel comfortable with how you're going to survive the next year or 2 years as you're building something. But I think that kind of making that leap is a very personal decision. And I think you need to just look at what it is that you're passionate about, that you're competent with, and that you see yourself do for the next 5 to 10 years.
Now, when you decided to take the entrepreneurial path, what was the reaction from your colleagues and your family?
My Asian parents were like, we don't understand what this is. Why can't you be a doctor? No, you're very good at that and you are at a great institution. We spent a lot of money and sacrificed a lot for you to be there. So, why make that decision? But, that happens in every family, right? So you have to be patient and explain to them what you're doing. And eventually, they understand. My peers, I think, were the ones who reacted the strongest. I think that back in the days, it was still kind of uncommon for a clinician, especially at a top institution, to kind of make that leap and go to industry. Or I mean, in my case, I wasn't really going to industry. I was really kind of starting a company, which was kind of a different beast of it, in its own. But at the same time, I felt that there was a certain degree of admiration for the risk taking for doing that. And they were like, wow, go for it. And depending on who you speak with, I think that clinicians kind of get to a point in their career where there's a certain degree of burnout, and they look on the other side, and the grass looks always greener on the other side. But I think something that I would like to share to your audience is that, yes, it may seem that the grass is always green on the other side, but believe me, entrepreneurship is tough, right? It requires a lot of sacrifice. It's not a luxurious lifestyle, and it takes a lot of sacrifice and effort. Maybe not as bad as being on call and working 100-hour weeks, but it's tough sometimes.
Yeah, give us an example of some of the sacrifices of entrepreneurship that's not apparently obvious.
Yeah, I mean, your salary takes a dip because you only have so much time, so you have to make some cuts somewhere. I remember that when we were building Rubicon MD, I had to make weekly trips to New York, and couldn't necessarily, afford to stay in a hotel or anything like that. So I slept on my sister's couch in a tiny apartment, for months at a time. And so we think of that fund as we think about the success of the company. But, I think your time is split, your relationships suffer, and it's a work of passion, really.
Now, for physicians who want to take that entrepreneurial path, is it necessary that they get an MBA?
I don't think so. I think it helps for sure. I think there are wonderful MBA programs out there where you get to network and meet. If you talk to people who have gotten MBAs, many of them, not all, but many of them will say that the biggest value of an MBA is the network that comes with it. So it depends kind of what stage of your career you are. Obviously, if you're in your 20s or early 30s, it makes sense to do a joint program, for example, if you're an MD. If you're kind of at a later stage, the question is it worthwhile to do an executive MBA? That's crossed my mind. I think about it on a very regular basis even now, but I think there's so much more to entrepreneurship than getting a degree, right? I think it's a craft in a way, it's a mindset, and there's a lot of opportunity to learn on the fly, especially if you surround yourself with people a lot smarter and wiser than you who can mentor you along the way, and that you kind of have this mindset of this beginner's mindset, right? That you are starting on this path of entrepreneurship in the same way that you started on a path of being an intern and learning and observing and just trying to do the right thing.
We're talking to Julien Pham. He's a nephrologist and a healthcare entrepreneur. His Kevin MD article is titled The Evolving Role of Physicians in Healthcare. So, Julien, for those physicians who may be listening and they're already in clinical practice, but they have a kernel of an entrepreneur idea and they may want to pursue that, tell them what's their immediate next steps they should do.
The immediate next step is to network. Be known as a physician who has that kernel of entrepreneurship, right? And so be connected, be an advisor, be an influencer, be an early adopter for some of these startups around you. And where do you find them? You have to go out there and network and socialize. Go to events, go to hackathons, go to whatever it takes. Find CEOs and entrepreneurs and say, hey, you know what? Like I'm Dr. So-and-so. This is my specialty. Oh, it looks like you are innovating in the fertility space. It turns out I'm a IVF doctor, and maybe I can give you some insight on kind of what it's like. Maybe I can my clinic can be a pilot site for you. So there are many ways for physicians to get involved. So I would say number one is network. Be known within your ecosystem, in your community, and then after that, it's just the different directions that you take depending on your experience and what you're willing to do, and you stack experience on top of experience. You may start as an early adopter and the person who's going to try that technology and be very open-minded about it and give feedback. You may have enough experience to be an advisor, and these companies may say, oh wow, thank you for trying my platform in your clinic for the past 6 months. Like, you've learned a lot about it, you've been so helpful to us, like, would you be willing to be an advisor for this company? And take that opportunity if it's a good fit for you. It doesn't hurt. I mean, it's just time and commitment and your expertise. And then after that, as you grow, maybe you will put money where your mouth is, and you believe in the technology so much that you can become an angel investor and back these companies and do all of the above, right? Be an influencer and an adopter, but also be an advisor to these companies as you invest in them.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I think that the profile, the phenotype of the physician, innovator, the physician investor is very unique because we've been in the driver's seat and we, have this empathy. And most importantly, we went into medicine, most of us went into medicine because we wanted to impact the world, right? And I hope that spirit stays as you are transitioning from being a clinician to being an operator or an investor, because you still want to maybe try your best to put a drug out as quickly as possible, as safely as possible, so that patients can, have access to a new medication. Maybe you want to put a new technology, a new platform to go out there. But at the end of the day, I think what's most important is to preserve this code of ethics, right? And this oath that we took when we donned the white coat, the Hippocratic oath that to do no harm. And I think there are many ways to do no harm. You can do no harm in the practice of medicine. You can do no harm in as you are scaling technologies and make sure that what you're putting out there is efficacious, effective, and safe. And as an investor now today, I try to do no harm because I try to select and invest in companies that I think are going to have an impact in the world while I return capital to my investors. And this do no harm from a fiduciary standpoint is I don't want to lose money for my investors and don't want to do financial harm to them. So I think there are many dimensions to think about, but I think that we are really hardwired to really create impact in the world, whichever way we apply our skill sets.
Julien, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks, Kevin.